Hi, ma'am. I'm
Oh,
Kate
thank
from the
goodness
First
you're
Response
here.
Service. What's going on?
My baby's not breathing very well. He's been sick.
Oh, golly. So, the scene is safe. Does your baby appear to be acting normally?
No.
Okay.
He's had a cold for a couple days.
Okay, all right.
And I noticed today that he just isn't breathing the way that he normally
so
breathes.
would you say he's working hard to breathe?
Oh, very much so.
Okay, and then what do you think about his circulation to the skin? Does his skin look normal?
No.
Okay, all right.
He's usually very pink.
Okay.
And no, it's not
All right,
normal
so
at all.
if I apply the pediatric assessment triangle, I would say that this is abnormal appearance, abnormal work of breathing, and abnormal circulation to the skin. So I think your baby is having a respiratory problem. Would you mind if I checked him out?
Oh, absolutely.
Okay, it's a
absolutely.
high priority. So I'm just assessing your baby's airway. I'm listening for sounds of obstruction, gurgling, stridor, any of that. It seems like your baby has an open airway. I'm going to go ahead and look at your baby's work of breathing here. I'm looking for chest rise, rate and rhythm. I'm going to go ahead and attach an SpO2. And what does that number say? Make something up.
It says 86%.
Oh my goodness. All right, you know what we're going to do? We're going to give your baby a little oxygen. So I'm going to attach this pediatric non-rebreather to an oxygen mask. Do you think you could just hold that over your baby's?
Absolutely.
Just kind of nearby, see if it will maybe just give your baby a little extra oxygen. Okay. I'm going to continue on with my primary survey. I'm going to check your baby's pulse. Just feeling for a pulse. I'm feeling your baby's skin. It feels kind of cold and vinyl-y. And I'm going to look at some capillary refill here. And that looks quite delayed. Okay, so I think your baby's kind of sick. Let's see if this oxygen is helping at all.
I don't know that it is.
I don't think it is either. You know what I'd like to do? I'd like to help your baby breathe.
Okay.
So could I put your baby on the table?
Yep.
Okay, I have him. I have his head.
Okay.
All right, we're going to bring him to the table. We're going to put a little padding behind his shoulders. We're going to connect up this little bag valve mask to some oxygen. And we're going to help your baby breathe. I think the ambulance will be here in just a little bit. And we're going to give one breath every 3 to 5 seconds. I see good chest rise. And I'm going to monitor SpO2 and pulse and see if this baby starts to perk up with a little positive pressure ventilation. Oh, hey Dave, you guys are here.
We're
hey.
here from your favorite ambulance service.
Yep. So this baby's been sick for a couple of days with a cold, and I think he just got kind of tired out, and he's not breathing so well. So I'm bagging him. But I'll tell you, when I did my primary survey, his skin is really cool. His piggy toes are kind of mottled, and his cap refill is about 5 seconds.
Oh, it
so
sounds like he needs a fluid bolus.
it does. I haven't asked Mom about diapers. I think she said they were dry and she hadn't made any, but we can go ahead and do that.
And about how much do you think baby weighs?
Oh, he weighs 22 pounds.
22 pounds.
The last
okay.
pediatrician's visit.
Okay, so that's going to be about
Yep.
10 kilograms, and we're going to be giving 20 cc's per kilogram, so we're going to be
Perfect.
giving a fluid bolus of 200 milliliters.
Perfect.
We're going to get set up for an IO. Does that sound like a plan?
Yes. And I can move the baby to the end of the table
Just
so
to give
you
me a little
can.
bit more room.
Yeah, you want to trade sides?
Sure.
How about if we do that? And I'll come right here. Does that work for you? Great. And then Mr. Cinematographer, you might have to move around to this side. Focus on his setup.
I'm going to connect our drip set to our bag of saline. Flush that all the way through. I'm going to hook up my 3-way stopcock so we can accurately measure how much fluid we're going to be giving this
Good deal.
nugget. Up to clock here. I'm gonna make sure that that is angled up and that we can flush all the way through. Make sure there's no bubbles. Down. To get my appropriately sized needle, my driver, my securing equipment, as well as my 60cc syringe, a 50cc syringe.
50-60.
Attach that to my three-way stopcock as well, which is how I will accurately measure how much saline we're going to be giving to the child. Okay, so now I have this system all set up. Identify my site, and for my pediatric patient, it's going to be the tibial plateau. So I'm going to put one finger down and one finger over, right about there. My gloves on and my aseptic technique.
Smallest alcohol prep in the world.
And we will scrub for 30 full seconds. I'm going to hold my hand down out of the way over here. Puncture the skin. Drill down. I'm sharpening my needle.
Wow.
I'm going to put down my securing device.
Back the baby, I was watching.
Turn my three-way stopcock off to the bag. Pull back a little bit. I see some blood and some good marrow there. So I'm going to flip off to the patient. I'm going to draw off the bag my first 50 cc's. And to create the full 200 cc bolus, which is going to be 20 milliliters per kilogram, I will start to infuse as such.
Yeah, and I don't see any signs of infiltration. It looks like it's
Nope.
going in. I don't see any swelling behind the leg there. That looks
Nope.
like a good IO. All right. You think the crew's ready to transport?
I think this is a good time to transport.
All right. And what would we see if this bolus works?
If this bolus works, we would see hopefully a decrease in heart rate. We'll see the baby will pink up a little bit. The cap refill will drop from the 5 or 6 seconds that it was earlier, to hopefully 3 to 4 seconds or even less.
Excellent.
The baby
Good
should
deal.
perk up in general.
Thanks for coming, Dave.
Hey,
All
happy
right.
to help out.
Here
Let's
we
get this
go.
baby to the hospital.
Okay.